Hi, my name is Joyce Artiam, and I'm going to tell you about glucocorticoid-induced osteoporosis. Definitions. Glucocorticoid-induced osteoporosis is a form of osteoporosis that is caused by taking glucocorticoid medicines. These drugs include prednisolone, dexamethasone, and cortisone. There come treatments of many rheumatic, joint, and muscles disease, including rheumatoid arthritis, lupus, myositis, muscle inflammations, and polymyalgia rheumatica.
Osteoporosis is a bone disease that causes more than 8.9 million broken bones worldwide across men and women every year, resulting in an osteoporotic bone break every 3 seconds. Osteoporosis is a medical condition that weakens bones and makes them more likely to break. They can become so fragile that in serious cases, a strong sneeze or minor bumps can cause them to break. Wondering why you haven't heard more about osteoporosis? Well, one reason could be that it is known as a silent disease because you can't see or feel bone loss, so it goes unnoticed until the first bone break occurs. Both men and women are at risk of osteoporosis. Postmenopausal women are at a higher risk. After an initial fracture, these women are 5 times more likely to suffer another bone break within a year. The World Health Organization, WHO, has considered osteoporosis to be of increasing importance. Many women remain untreated within 6 months after an osteoporosis-related fracture. It's important to be aware of the risk factors associated with osteoporosis in order to understand if you could be affected. Here are a few to consider. Previous bone break as an adult. Advanced age. Low bone mineral density. Parental history of hip fracture. Low body weight. Smoking. You've likely heard that vitamin D, calcium, and weight-bearing exercise can help keep bones healthy. It's true, but for people with osteoporosis, it may not be enough to protect against a fracture. Osteoporosis and broken bones are not a normal part of aging. If you are a postmenopausal woman, you may be at risk for osteoporosis. It's important to talk to your doctor about a bone health plan.
Our next speaker is Dr. Ken Sag. Ken received his bachelor's degree at Michigan, his medical degree at Northwestern. He got a master's in science and epidemiology at Iowa. He was a resident at Northwestern, a fellow in rheumatology at Iowa, professor now at the Division of Clinical Immunology and Rheumatology at UAB. He's director of the CERTS at UAB and associate director of the UAB Center for Metabolic Bone Disease. He's won the Teacher of the Year Award. He's gotten the Max Cooper Research Award. He's been co-chair of the AMA Consortium on Osteoporosis Quality Measures. He's a member now of the FDA Arthritis Drugs Advisory Committee, co-chair of the ACR Quality Measures Subcommittee, Board of Trustees, National Osteoporosis Foundation. He's been the osteoporosis section editor for the Current Opinions in Rheumatology, osteoporosis section editor for Current Rheumatology Reports, and the editorial board of Arthritis Care and Research in the Archives of Internal Medicine. And this morning, he's going to talk about glucocorticoid-induced osteoporosis.
Thanks very much, David, and good morning. It's a great pleasure to be here and to see this wonderful course continuing to thrive, and to have an opportunity to talk about a topic of interest to all of us, since this is one of our favorite drugs. Despite all the great advances that have occurred in our field, we continue to rely heavily, for better and for worse, on glucocorticoids. Steve's talk was wonderful. It's always great to hear him speak and to hear some of the controversies in his very evidence-based but yet common sense approach to how we take care of our patients. Here are my disclosures, and these are also contained in your handout. And I think it's always nice to start with the case, and this is my favorite case, and I'm sure one of your favorite cases too. Not favorite in that it's something we like to see happen, but favorite in terms of this being really the poster child for our problem. This is the older Caucasian woman who you diagnosed with temporal arteritis and appropriately start on high-dose glucocorticoids, and she develops the very predictable complication of compression fractures of her spine within the course of a year. So this is what we're trying to prevent. This case occurred at a time when our options were quite limited. But it's not just this patient that we worry about. Here's the guy who I saw at the Iowa City Veterans Hospital who was referred to rule out rheumatoid arthritis, but had one of the worst looking spines of a man his age and had been on 10 milligrams a day of prednisone for the past 10 years for management of his COPD. And here's one of our younger-ish lupus patients who
Applications in medicines. Approximately 1% of all adults and 3% of adults older than 50 years of age receive glucocorticoids for allergies, inflammatory conditions, or cancer. Long-term use of glucocorticoids is associated with clinical significant toxic effects.
Osteoporosis is when your bones deteriorate, putting you more at risk for fractures. Your bones protect your internal organs, store minerals your body needs, and give your body structure. Your bones are alive, and in order to stay healthy, they need calcium, protein, phosphorus, magnesium, and vitamins A and D. Your bones take most of these vitamins and minerals from what you eat and drink. Your bones are constantly being repaired and reconstructed, and new bone is always being formed. Cells called osteoclasts dissolve your damaged bone, leaving tiny holes. Once the damaged bone is removed, cells called osteoblasts take calcium from your bloodstream and fill the holes with new, healthy bone. Osteoclasts and osteoblasts need hormones in order to work properly. If they can't get enough of the hormones they need, they aren't able to repair and rebuild your bones. This is one of the main causes of osteoporosis. Other causes of osteoporosis are not getting enough vitamins and minerals, poor eating habits, and not getting enough exercise. If you think you could be at risk for osteoporosis, talk to your doctor.
Pros and cons. Pros. The risk of fracture rapidly decreases when glucocorticoids are discontinued. Daily calcium and vitamin D supplements can help prevent loss of bone mass.
Glucocorticosteroids directly act on the nasal passage epithelial cells and on the T lymphocytes, mast cells, and eosinophils of the immune system. These target cells have cell membranes composed of glucocorticosteroid dissolving lipids. The glucocorticosteroids routinely cross into the cell membrane and cell cytoplasm. Glucocorticosteroids bind to the glucocorticoid receptor to form a glucocorticosteroid receptor complex after entering the cytoplasm. These receptors are particularly common in the nasal epithelium and blood vessels, though they are present on nearly all cells. Glucocorticosteroid receptor complex formation has two effects. To fight the effects of cytokines, the new complex first binds to the activator protein 1, or AP1. This inhibits cell response to chemical messengers like inflammatory cytokines, reducing inflammation. Glucocorticosteroid receptor formation also causes the complex to move to the cell nucleus, where it binds with the glucocorticoid response elements, or GREs, which control protein production. This binding decreases pro-inflammatory cytokine production and increases anti-inflammatory protein production.
Cons. Taking a glucocorticoid medications, sometimes called corticoids, for treatments of inflammatory arthritis or other health problem may weaken your bones.
Osteoclasts and their precursor cells are regulated by different signaling pathways and molecules. One key regulatory molecule is the protein rank ligand, which is produced by a variety of cell types, including osteoblasts and their precursor cells. This protein has been shown to exert its effects on osteoclasts and their precursors through an interaction with the cell surface receptor, rank. The interaction between rank ligand and its receptor, rank, triggers the activation of signaling pathways, which are involved in the differentiation, activation, and survival of osteoclasts. Such signaling pathways can trigger the fusion of precursor cells to form mature multinucleated osteoclasts. On these mature cells, rank ligand can interact with its receptor, promoting osteoclast activity and survival, leading to increased resorption of bone. To balance the effect of rank ligand, osteoprotegerin, or OPG, is secreted from osteoblasts. This protein acts like a decoy in binding to rank ligand, preventing rank ligand from interacting with and activating its receptor on the surface of osteoclasts. Various hormones and cytokines modulate the balance between rank ligand and OPG. For example, parathyroid hormone stimulates the production of rank ligand while at the same time repressing the expression of OPG, an effect thought to increase the activity of osteoclasts. Conversely, estrogen can increase the expression of OPG and inhibits rank ligand signaling. These changes, which are thought to reduce the activity of osteoclasts, may contribute to estrogen's ability to preserve or increase skeletal mass.
Issue applied in Ecuador. In Ecuador, approximately 1 million women suffer from osteoporosis, with a prevalence in the postmenopausal populations of 25%, 1 in 4. This disease is estimated to cause 25,000 fractures each year. About 1 in 3 women and 1 in 5 men over 50 will experience an osteoporosis in fracture in their lifetime. Conclusions. Osteoporosis is common in patients requiring long-term treatment with glucocorticoids. Careful attention to prevent, manage, minimize the severity of these serious complications. Thanks.